Hello, welcome back to Chaplain for PTSD. I am Chaplain Farr, and I want to say I'm sorry that I haven't posted anything in a little bit. Unfortunately, I had to have emergency surgery a couple of weeks ago to have my gallbladder removed, so it's been a grueling couple of weeks. But today I'm back and moving around and ready to go. I want to get moving back on what I was doing before and want to talk today. I want to explore um, a widely recommended treatment for post traumatic stress disorder called cognitive behavioral therapy, more commonly known as CBT. So, what is it and how does it work? Well, CBT at its core is built on an understanding that our thoughts, feelings, and behaviors are all interconnected. Imagine them as a three points of a triangle. The therapy operates on the principle that if you make positive change in one of those areas, it can create powerful and positive shift in the other two. For instance, um, a major goal of CBT is to help you identify and alter unhealthy ways of thinking. By changing those thought patterns, you can develop healthier behavioral and gain better control of your emotions. Um, it it's a very practical approach that targets the current problems and symptoms of a person dealing with PTSD or trauma rather than focusing on exclusively on the past. Now, you might be wondering what the process looks like. A standard course of CBT is typically delivered over 12 to 16 sessions. Um, you also have flexibility in the format. It can be done individual, one on one sessions with therapists, in a group setting with others. It is important to understand also to talk about the experience itself. One of the great things about this therapy is that there is no physical risk involved. However, it is critical to know that the process can be emotionally intense at times for certain individuals. Um, as you begin to work through difficult experiences, the therapy may bring up uncomfortable thoughts and painful emotions. Um, this is a normal part of the process, but sometimes, but something to be prepared for when you begin a healthy journey. Now, using CBT to treat PTSD, um, congenital behavioral therapy is a type of talk therapy designed to help people manage their problems by changing unhelpful thought patterns and behaviors. It's a goal oriented approach that focuses on the current issues and finding practical solutions, as I said before. Um, the core of CBT involves teaching individuals to recognize negative thoughts and feelings, challenge those challenge their accuracy, and replace them with more positive and realistic ones, which leads to healthier actions and improves emotional responses. That's that pyramid. Um, Therapists assist patients in reevaluating their thinking to identify unhelpful patterns. This is These are often called distortions. Examples of these distortions could include um, overgeneralizing bad outcomes, um, engaging in negative thinking that diminishes positive thinking, always expecting a catastrophic outcome. Um, the goal is to shift the patients towards more balanced and effective thinking patterns, which helps to reduce the symptoms and improve overall functioning. CBT it employs a variety of techniques to achieve this. Um, Education about how trauma can affect an individual, instruction in methods of relaxation, stress management, and crisis planning, controlled exposure, which is planned and um, collaborative, collaboratively, get tongue tied sometimes, collaboratively um, planned between the patient and the therapist. And now this technique aims to reduce escape and avoidance behavior and reduce a sense, and it helps restore a sense of control, self confidence, and predictability for the patient. Um, CBT is a very flexible treatment, allowing the provider and the patient to select the components um, that are likely to be most effective for that specific individual. So, like I've said it before in other videos, not everything works for everybody. Some things will work for one person, but might not work for somebody else. So you try one, and then you try another. And some therapists, while talking with you, they already have ideas of which ones might work with you. The therapy has proven effective for a wide range of conditions, such as anxiety, depression, eating disorders, even physical issues like insomnia, sleepwalking, um, sleep apnea, chronic pain. Um, it can be delivered in a variety of formats, which I've said before a little earlier. Um, and it also, you can do it online or actually in person. It doesn't have to be just in person. You can actually do it over Zoom. Um, Now, how CBT works? Um, there's basically uh, it's like a four-part breakdown. So you identify the connection. So it's based on the idea that your thoughts, feelings, and behaviors are interconnected. Then you challenge those negative thoughts and you learn to identify unhealthy thought patterns and beliefs that contribute to your distress. Then you replace those negative thoughts, and the therapy then teaches you strategies to challenge these negative thoughts and replace them with more logical and helpful ones. And then by changing your thinking, you can change your feelings and behaviors and breaking the cycles of unhelpful patterns. Now, some key principles are it focuses on the present. Um, its primary focus is the current problems and symptoms. It doesn't want to dwell on the past. Um, it's goal oriented and structured. There is active participation. So there's active participation in the process, the learning, and practicing the new skills that you learn, the techniques. And then, most importantly, it's evidence based. CBT is a well researched and evidence based form of psychotherapy, meaning its effectiveness is supported by scientific studies. That's the most important thing. there's a lot of things out there. People go, oh, well, this works and this works and this works. Sometimes they do, but evidence based is the ones that are truly, they've been studied, they've been peer reviewed. Those are the ones that really do work. We know for a fact it's scientifically based. Now, let me give you a few examples of some CBT techniques. You have cognitive restructuring. Now, this involves identifying negative or unhelpful thoughts, challenging them with more balanced and realistic ones. Like, for example, someone with social anxiety might be encouraged to challenge the thought, everyone will judge me. By considering evidence of positive social interacting, they've had in the past. So basically, how this would work is you identify that negative thought. So the first step is to become aware of the automatic negative thought that arises in the response situation. Then you evaluate the evidence. Once identified, these thoughts are examined to see if they are based on fact or emotion, and whether they're evidence to support or contradict them. And then reframe the thoughts, reframing the thoughts. And you take these negative thoughts that are challenged and replace them with more balanced, realistic, and positive perspectives. So, as I said, like that person with the social anxiety, everyone's going to judge me. Now, is that true? Is there actual evidence, or is that emotions? That's where you find that evidence. And then you reframe it with the positive. Now, there's some key steps: building awareness, recognizing and identifying those negative thoughts. That's where the practice comes in and the training with the therapist. And then systematically evaluating, examining that evidence for and against those thoughts. That's the reason why, it's something that just can't be done just like this. It takes time. That's the reason 12 to 16 sessions. It takes time. And then even after that, it takes time. You still have to keep practicing and practicing and practicing them. And then challenging and reframing. And that, like, replacing distorted and negative thoughts with the more positive and realistic ones. So here's another example. Instead of thinking, I'm going to fail this presentation, a person practicing cognitive reconstructing might reframe it to, I'm feeling nervous, but I've prepared well, and even if I make a few mistakes, it's not the end of the world. You see the difference? They might still fail, but it's not the end of the world. In essence, cognitive reconstructing helps individuals develop a more balanced and adaptive way of thinking, leading to improved emotional regulation and overall mental well-being. And then know when to seek help. That's the biggest thing. If you're trying to do this on your own, you have to know, you have to go seek help. You have to know if you're constantly struggling with stress or experience discomfort during the relaxation technique. Speak with a professional psychiatrist or healthcare provider. Let them know what's going on. Please, you have to take that first step and seek help. That's the biggest thing. Chaplain Farr signing off. Until next time.